When I was young, I wanted to be a doctor. But by the time when the time came to make a career choice, I knew I didn't want to be a doctor. So then I was looking for alternative careers in the health sector. And I was very fortunate to come to know about the field of speech and hearing. And after I got to know the job profile of a speech pathologist and audiologist, the job opportunities, I got very interested and I visited a few centers and I could make up my mind very easily. What does a speech pathologist and audiologist do? We work with all kinds of communication disorders. And what are communication disorders would most people would wonder, is there a job for a communication specialist? Communication disorders affect the social life, the emotional life, the professional life of a person. It is the essence of a human being. And so there are people who are unable to talk, who are unable to communicate, or unable to hear communication. There are children who do not learn to speak. And there are adults who lose their communication abilities either due to accidents or due to cancer. So we are trained to deal with the whole range of communication disorders. A speech pathologist is like a doctor and a teacher. And that's what attracted me to this field, because you are doing an analysis and diagnosis of the client, and you have to formulate a treatment program for the client. Today, the field is not only rewarding, and it has also got a lot of money. It is a very attractive job today for youngsters to take up because there's a big shortage of professionals. And in the past decade, there has been an increasing awareness of the treatment for speech and hearing problems. So the demand for professionals has increased a lot. There's a demand in India as well as in the US. Our first batch has 15 students and they will be completing their final year this year. And then they have a 1-year internship, after which they can go out and work. The degree program is 4 years, and after that they can do a master's degree and you can pursue your PhD also. So at the institute at present we are only offering a degree program in speech and hearing science, which is, our institute is affiliated to Bangalore University and it is recognized by the Rehabilitation Council of India. We have 5 staff with us, including ourselves, to take care of the core subjects, and we have about 8 visiting faculty who look after the allied subjects. Our clinical practicum is very important in our field, and from day one our students are exposed to the practical aspect of the field. We have a tie-up with 2 hospitals in Bangalore where our students go 3 times a week to do the clinical practicum, and we also have an OPD at the institute which caters for all the assessment and therapy for speech and hearing problems.
She is a second year student whom I am supervising on a case by name Yashwant. This child has been implanted. He is on a cochlear implant since 6 months, and we have been training him on a few activities to develop language. सुनो दीदी क्या बोल रही है? क्या है ये? एरोप्लेन. एरोप्लेन कैसे बोलता है? कैसे बोलता है एरोप्लेन? हाँ बोलो. Very good. Good boy.
यशवंत क्या है ये? कैसी जाती है कार?
कार कैसे जाती है यशवंत? बोलो.
Baby.
Very good.
Baby. Baby. Elephant.
Very good. Very good. Very good. Good boy.
Hello, my name is Dr. Preeti Singh. I'm a consultant neurologist at Samvaad Hospital, and in my practice daily I see patients who require speech therapy. Many of them are victims of stroke and head injury and have severe deficits which need help. We have a separate neuro-rehabilitation ward in our hospital where we can admit such patients who have speech problems, but for the lack of speech pathologists, we are not able to run the department up to its full efficiency.
What you see here is a pure tone audiological evaluation going on, and here is a patient with a hearing impairment, and we are testing his hearing threshold across various frequencies. So we check his right ear and left ear, and we obtain the threshold for different frequencies and plot them on a graph called audiogram, and the results are then diagnosed based on the degree and the type of hearing impairment. So this is a primary test when the patient walks into our audiology department. This is the primary test what we do. And once the diagnosis is done, we recommend the client for further evaluation for differential diagnostic purpose.
This is called as a middle ear analyzer. It's called GSI TIMSTAR 1 version 1, and it is basically to analyze how the middle ear is functioning. Okay, as we know, we have three parts of the ear: the outer ear, the middle ear and the inner ear. This instrument is sensitive more to the middle ear part of the auditory system. In this test we have two things, that is one is called the tympanometry and the other one is called the reflexometry. Together we get a diagnostic formulation. So just one of the tests does not serve our purpose to a greater extent. The combination works. The results of both the tympanometry and reflexometry gives us a clear indication of what exactly is the middle ear pathology in terms of either it is otosclerosis, middle ear effusion or tympanosclerosis, or anything related to the middle ear and the outer ear.
I am Sarda Prasad from Orissa. I am pursuing my final year BSLP in this college. The course is really very challenging and very enthusiastic in nature. The practical knowledge which we get is booming, and it's also very enthusiastic. The clients which we come over here are really of varieties, and it's really worth working with them and to notice that changes which occur as time goes on. And at last I would like to conclude by saying that service to humanity is service to God.
Yeah, my son has a stammering problem since long back. So when we came to the Samvaad speech therapy, so we came here for 2 months back only. Now he is 99% recovered. The Samvaad speech, these people are treated him very well, and these people are given a lot of confidence to him. Now really I am so happy about that, and really now he can. Earlier he is not to mingle with any person. He has an inferiority complex. Now everything is gone, and he's become a very perfect boy. So really I am very happy. These people are treated very well.
The test being done is called as autoacoustic emission. It is one of the electrophysiological tests which we do. Here we are basically seeing the waveforms on the screen, wherein it shows the integrity of the outer hair cells in the cochlea. It is one of the tests for differential diagnosis, wherein you want to check how well the inner ear of the client is.
This is a child with misarticulation. He has been attending therapy program for the past 1 year, and he has got certain sound difficulty in pronouncing certain sounds that are present in his language. So what is going on here is she is a second year BSLP student, and she is working on certain sounds in general conversation.
Okay, I'll give you another one.
So she is carrying out a therapy program for correcting his speech errors.
Quickly do one and then we'll do again. Fast. Press one. Fast. Okay.
Again a good catch.
Say this word quickly. What's this?
Tomato.
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 No, I'm hearing a t.
Tomato.
Just show the production alone.
Tomato.
Do this side, behind your teeth.
Say.
Behind your teeth. You say that?
Tomato.
No, that's not tomato. To. Look at
Tomato.
Auntie's mouth.
Open your mouth and show you. Show.
To. Side.
Where is the tongue?
Tomato.
Very good.
That is a tomato. Give a 5.
3, 4, 5, 6, 7, 8, 9, 10.
10. 10. 10. Oh, only once.
TV.
TV. Very good. What is this? What is this?
Telephone.
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 Toto. Very good. Telephone.
Telephone.
Good.
I'm Mamata. I'm the mother of Sai Charan Reddy. I came to know about this institute when I visited the Dr. Deshpande about his speech and all. He recommended to go here, so I came here. They tested him and told we will treat him, will give the treatment so that he can pronounce all the sounds and all. They started the treatment, they recorded his speech and all, and they started with kaga like that, with the goggling and all. Now he is able to pronounce the sound, and as well as he is speaking out little sentences also.